Have you ever felt that something has changed in your body but couldn't quite pinpoint what it was? Have you noticed you're going to the bathroom more often than you should, or that you never fully empty your bladder? What if I told you that these signs, often ignored, could be your prostate trying to warn you about something? And what about the idea that only older men need to worry about this? Is that really true? These doubts and fears are more common than you might think, especially among men over 40. The problem is that, due to embarrassment, lack of information, or simple neglect, many ignore the early signs and only seek help when the situation has already worsened. But today, you'll understand exactly what happens to your prostate as time passes, why it demands your attention, and what you can do right now, starting today, to protect your health and prevent future complications. And in this video, I'll share an important tip that can directly help prevent inflammation and even more serious conditions. Stay with me until the end, because this information could change the course of your health. I'm Rachel Hayes, and this is the Global Health Guide channel. Take a moment to subscribe as we talk about health here in a clear and straightforward way. Let's start with a story. Michael is 47 years old, works in an office, has a busy routine, takes care of his family, and rarely visits the doctor. He started noticing that he was waking up several times at night to urinate. He also noticed some difficulty starting to urinate, and at times, a feeling that there was still urine in his bladder even after he finished. At first, he thought it was due to stress or aging and ignored it. The problem is that these small signs are often the first warnings that the prostate is changing. The prostate is a small gland, about the size of a walnut, located just below the bladder. It's part of the male reproductive system and plays an essential role in producing seminal fluid. But as the years go by, especially after 40, it begins to undergo natural changes, and that's where the danger lies. The first of these changes is an increase in size. This growth, often benign, is called benign prostatic hyperplasia. Even though it's benign, it can cause significant discomfort. Imagine the urinary canal being compressed by a gland that's larger than it should be. The result, weaker urine flow, a constant urge to urinate, and that feeling of a full bladder even after urinating. Another significant change happens with hormones. Testosterone levels decrease with age, but a derivative of it, called dihydrotestosterone, tends to increase, and this hormone can further stimulate prostate growth. This not only contributes to the increase in size, but also raises the risk of inflammation and even more serious cellular changes. Here's a fact you may not know. According to the National Cancer Institute of the United States, NIH, prostate cancer is the second most common cancer among men, surpassed only by skin cancer, and the later the diagnosis, the lower the chances of effective treatment. But don't worry, this isn't meant to scare you. It's meant to alert you. The good news is that there are ways to identify these changes early, and even better, ways to prevent them. Did you know, for example, that the frequency of ejaculation can play a positive role in prostate health? That's right. A study published in the journal European Urology analyzed thousands of men and concluded that those who ejaculated about 21 times per month had a lower risk of developing prostate cancer. The explanation is that ejaculation helps clean the prostate, eliminating substances that, if accumulated, could cause inflammation. But let's be clear, this doesn't mean it's the only factor. Frequent ejaculation doesn't make up for poor habits, a sedentary lifestyle, or an unhealthy diet. Prostate health care must be multifaceted and balanced. So, in this first part, I want you to understand the three main changes that happen to the prostate after 40. The first is prostate growth and fluid buildup. This can cause pressure in the pelvic area, urinary discomfort, and even infections if not properly managed. And it's not just about ejaculation. Here, hydration and a diet rich in antioxidants make all the difference. The second is hormonal changes, as we mentioned earlier. Regular physical activity can help keep hormone levels more balanced and, as a bonus, improve circulation in the pelvic region, which also supports prostate health. And the third is the increased risk of cellular changes that can lead to cancer. That's why routine exams are non-negotiable. The PSA test and digital rectal exam should be done annually starting at age 40, even without symptoms. The earlier something is detected, the simpler the treatment will be. Now tell me something. Have you experienced any of these symptoms? Have you noticed any changes in your body that made you think about prostate health? Or are you still hesitant about getting exams? Share in the comments. I'd love to hear about your experience. In the second part, I'll show you what Michael did to reverse many of the symptoms he was feeling and what you can apply in your life starting today. Plus, I'll list the main daily habits that help keep your prostate healthy in a practical and natural way. One of them is so simple that most people overlook it. Don't miss it. See you then. You learned in the first part about the changes the prostate undergoes after 40 and why it demands attention. Now it's time to talk about what can actually be done daily to protect this vital gland and avoid what many men only realize too late. Remember Michael? That 47-year-old man who started feeling urinary discomfort, waking up multiple times at night, and thought it was just part of aging? Well, he decided to take action. He started with a visit to the urologist, something he had been putting off for years. His PSA test showed minor changes, but nothing serious. Still, he was advised to change some habits, and that's when the transformation began. You'll now see the changes that made a difference for Michael, and that can help you too. First change, annual checkups. It sounds basic, but it's the first step. Medical recommendations are clear. Starting at age 40, every man should undergo routine exams to monitor prostate health. The PSA test, which is a blood test, and the digital rectal exam, which still carries a lot of stigma but is absolutely necessary. These exams allow any changes to be identified before they become a bigger problem. And if you're still embarrassed, think about this. What truly threatens your masculinity is ignoring your own health. Second change, proper nutrition. Michael realized he was eating a lot of red meat, processed foods, and ultra-processed products. With medical guidance, he started including more vegetables, fruits, and healthy fats like avocado, nuts, and olive oil. One food in particular stands out: tomatoes. They're rich in lycopene, an antioxidant that helps protect prostate cells. Studies suggest that regular consumption of tomatoes, especially when cooked, is linked to a reduced risk of prostate cancer. Third change, regular physical activity. You don't need to be an athlete. Michael chose daily walks and lightweight training 3 times a week. That was enough to improve his metabolism, regulate hormones, and enhance pelvic circulation. Plus, he discovered an exercise called Kegel exercises, which strengthen the pelvic floor muscles and improve urinary control, crucial for those already experiencing urine leakage or difficulty holding it. Fourth change, proper hydration. It seems simple, but drinking water regularly throughout the day helps keep the urinary system clean and reduces the chances of inflammation. Michael started carrying a water bottle to remind himself to drink even when he wasn't thirsty. Fifth change, stress management. Yes, stress also affects the prostate. Cortisol, the stress hormone, can disrupt other hormones and even weaken the immune system. Michael incorporated moments of pause into his day, started meditating, and reduced excessive work hours. These changes aren't just psychological, they directly impact physical health. Here's a key point. Michael didn't change everything at once. He started slowly, one step at a time. Real change happens with consistency. Plus, he began talking about it with other men in his circle. He broke the silence. He stopped treating prostate health as a taboo, and guess what? His friends started getting checkups too. The truth is, one act of courage can save lives. Now, an important reminder, caring for your prostate isn't an isolated task. It's part of a system. Everything you do, what you eat, how much you move, how you handle stress, directly or indirectly affects this gland's health. To wrap up, here's a quick list of actions you can start adopting today. Schedule your checkup with a urologist if you're over 40. Reduce consumption of red meat and processed foods. Increase intake of vegetables, especially tomatoes. Stay active. Any exercise is better than a sedentary lifestyle. Learn Kegel exercises. They're simple, quick, and effective. Drink at least 2 liters of water a day. Find ways to manage stress. Try walking, reading, or meditation. And finally, talk about it. Share information. Break the taboo. Do you already do any of these things? Which of these habits seems easiest for you to start? Share in the comments. Your experience might inspire others too. If this content helped you in any way, share it. Send it to your friends, brothers, or father. This kind of information can make a real difference in someone's life. Like the video, subscribe to the Global Health Guide channel, and turn on notifications so you don't miss our next content. See you next time.